Hello everyone. In today's topic we are going to discuss about the how to interpret ECG. So part 1 we are going to see. Already we have discussed about what is ECG, what are the basic concepts about ECG. So today we will see what are the types of ECG and how to basically when seeing an ECG strip paper, how we can easily diagnose which part of the heart is affected. Okay, these are the basic things we'll see in this video. So standard ECG. In standard ECG, there are 10 electrodes, the 4 limb electrodes and the 6 precordial electrodes. The 4 limb electrodes are the left arm and leg, right arm and the leg. So as you see here, the right arm and the left arm, right leg and the left leg. So these are the 4 limb electrodes in where the right leg is a neutral lead. As you can see here, the right leg is a neutral because it is something related to the charging and some electricity is being passed, so something need to be kept for the earthing. So this right leg, that lead is kept for the neutral as a neutral lead to avoid any earthing problem and shock and all. It is kept for the neutral lead. So and 6 precordial electrodes, that is the V1, V2, V3, V4, V5 and V6, which are placed around the chest. So transverse plane, if we cut the chest in transverse and if we see from the top part, no, so that is like a horizontal plane if we are cutting and seeing from the top part. So V1, V2, V3, V4, V5 and V6, because the heart is a three-dimensional organ, so it must be placed to record all the parts of the heart. So that's why the leads are placed each one in one of the position. And heart is a three-dimensional organ. So V1 to V6 are lined in transverse or horizontal plane of the chest. So it is lined here. So the electrode detect the charge outside the cell. As we have seen in the previous videos, the electrodes will detect the charge only outside the cell. Usually the dipole will be more towards the positive electrode. As you can see here, a negative dipole means both the negative and the positive side will be here, but usually it will be more toward the deflection will be more towards the positive side. So if here it is positive and it towards the deflection, its outside is positive, so the deflection is showing a curve, that is showing a wave upward. If it is like if the outside waves are outside charges are negative, then the deflection will be down, so it means that the deflection is negative. Okay, so each electrode will detect any wave of positive charge coming around them. So here it is detecting any positive charge which is coming towards them. So if here if it is there and here it is positive charge and here it is negative, then the deflection will be negative. Okay. So 12 lead ECG, everyone we have came across this word 12 lead ECG. So now we will see what is that. In coronal plane, coronal plane means if it is a front and back, if the body is dissected into front and back, that plane is called as the coronal plane. The non-neutral leads are called augmented vector right AVR and augmented vector left. Both are reported as vector that are 30° up from the horizontal lines. In the heart, if you are drawing a horizontal line and 30° from up above, that is the, if towards the left, that is AVL, and when towards the right, that is AVR, augmented vector right and the augmented vector left. Okay. So AVF is straight down. So we already saw that the right side is the neutral lead. So we have to take in consideration about the AVF, that is the augmented vector foot, that is the left foot. Okay. So these AVL, AVR and AVF detect any positive deflection coming towards them. So as we saw that they will detect any positive charge coming towards them. Okay. So there are also bipolar limb leads called as lead 1, lead 2, lead 3, which are recorded using 2 electrodes instead of 1. So as you know that bipole means that is positive and negative. Both will be 2 poles will be there. That is called as a bipole. Okay. So here the lead 1 is the right arm is taken as negative and the left arm is taken as positive. So it is towards the positive, that is the lead 1. Okay, so if it is lead 2, the right arm is taken as negative and the left leg is taken as positive, then that is lead 2. Lead 3 means the left arm is taken as negative and the left foot it is taken as positive. So that is the lead 3. So 1, 2, 3. We already saw that the ECG is about a heart, about a three-dimensional organ. So everything need to be considered. So that's why it's a 12 lead ECG is very much needed for detecting any abnormalities in the heart. Okay. So lead 1 uses right arm as negative and the left arm as the positive, forming a vector goes to the right. Okay. So lead 2, right arm is negative and right arm is negative and left leg is positive. Lead 3 is left arm is negative and the left leg is the positive. In total here you can see 1, 2, 3 AVR, AVL and AVF. So totally 6 limb leads are there and 6 chest leads. V1 to V6 six chest leads are there. So totally together they form as the 12 lead ECG. So totally 12 leads are there. It helps us to know about the different views of the heart, so making it easier to see how the depolarization occurs in the heart. So depolarization is basically the contraction of the heart. So it is very helpful to see how the heart is contracting. The 6 chest leads, the V1 to V6, detect the depolarization wave forming the QRS complex. As we know that here this is the P wave, QRS, and this is a smaller one is the T wave. So this QRS is basically detected by this V1 to V6. Okay, so that is the duty of this V1 to V6. Mostly depolarization wave negative in V1 and V2. You see here it is the deflection is towards the down, so the deflection is negative. Okay, and isoelectric, so no electrical charge, isoelectric neutral in the V3 and positive in V4, V5 and V6 as the deflection is towards up. Okay, so the deflection is positive upwards. Okay, so here you can see the lead 1 which is taking, which one is positive and negative. Lead 1 here is positive, lead 2 the left leg is positive, and the lead 3 also the left leg is the positive. Okay, and AVR, it is taking the right side as the positive, here it left leg is the left arm is the positive, and here the left foot is the positive, so AVF. Okay, so here you can see it's a 360 degree. The heart is a three-dimensional organ, so 360 degree must be recorded. So they are drawing a horizontal line. So from there 30 degree up is the AVL and 30 degree up is the AVR and direct down is the AVF. Okay, so and the lead 1 is the direct horizontal plane, that is the lead 1, and towards the right side is the lead 2 and towards the left side is the lead 3. Okay, so here you can see all the limb leads and the chest leads are grouped together based on the regions of the heart they present. So as you can see here, you can see there is this the inferior part of the heart. The right coronary artery is the one which supplies the blood. This is the septum. This is the anterior part of the heart. This is the lateral part of the heart. So inferior, the septum, anterior and the lateral. Okay, the colors are given now. So by this we can easily differentiate which part is being affected. Okay, we can see how we can detect that. Problems in the specific leads means problem in the specific region of the heart that may be affected by a disease. Okay, so lead 2, lead 3 and the AVF are the inferior leads. Here you can see the inferior part. So which one is means the lead 2, lead 3 and the AVF. So these are connecting the inferior part of the heart. So that is the meaning that the inferior part of the heart is affected. So the inferior part receives blood from the right coronary artery. Okay, so it means that something related to the right coronary artery or the inferior side, the heart is being affected. And lead 1 AVL, V5 and V6. So this side, lead 1 AVL, V5 and V6 this side. Okay, so this part means that is the lateral leads. So you can see the lateral side of the heart. The lateral part receive blood from the left circumflex artery. So the left circumflex artery is affected. And V1, V2 are the septal leads, as we saw here, the septal leads. The septum is the one which differentiates the right and the left. So it means that it is something related to the septum, it is affected. Okay, they are nearest to the intraventricular septum. And V3 and the V4 are the anterior leads. Here you see the anterior part of the heart, the front portion. of the heart. So here you can see V3 and the V4 are the anterior leads. They are nearer to the anterior wall of the heart. The lead 2 is the rhythm strip. It is used to calculate the heart rate and diagnose the abnormal cardiac rhythms. As you can see here, the lead 2 is the rhythm strip. It helps us to see how, like with using the R waves and counting the number of boxes. If you saw my already the previous videos, I have explained how to calculate the heart rate. Okay, so this is where the rhythm strip you can calculate the heart rate using this. Okay, so this is a ECG strip here. 1, 2, 3, and the 2, the rhythm strip will be present. AVR, AVL, AVF, V1, V2, V3, V4, V5 and V6 are present. So V1 and V2 are usually negative. We saw it's usually negative, and V3 is isoelectric, and V4, V5, V6 are usually deflection will be positive. Okay, so yes, we saw that the lead 2, lead 3 and the AVF are affected, means the inferior part is affected, and the lead 1, the AVL and the V5, V6 are affected, means the lateral part is affected, and the septum means the V1 and V2, and the anterior part is V3 and the V4. Okay, so these are the, like you can easily see in these pictures. So the lateral part, so 2 um, 2 and the left side AVL and the V5 and the V6 are affected. So the septum means the V1 and the V2, the anterior are the V3 and the V4, and the second part, these are the AVA, second, the third and the AVF. Okay, this means that the inferior part is affected. Okay, so this is a very basic thing about the interpretation of the ECG. So in next topic we will see something in more detail about how to interpret the ECG. So if you have any doubts, please post in the comment section below. So thank you so much.